first. Paul Gallagher, health correspondent at the newspaper. Afternoon to you, Paul.
Yeah, good afternoon.
I'm always waiting for that kind of scintilla of light, the moment when somebody blinks, whether it's Barclay or whether it's somebody from the BMA, whoever it happens to be. This seems a bit immovable at the moment, Paul. Is there any suggestion that there might be some kind of breakthrough on this?
Certainly not at the minute. I mean, both sides pretty intransigent. I mean, the BMA are looking for pay restoration to 2008 levels. The union says junior doctors have lost, or the real terms pay has gone down by over 26% over the last 15 years. And to achieve pay restoration would require a 35.3% pay rise in a single year. And the government have said that's simply not affordable. The government have offered what they call their final pay offer. That's a 6% pay rise to junior doctors plus a consolidated £1,250 payment to all junior doctors. That works out on average as an 8.8% pay rise. The lowest paid junior doctors, those just entering their first year in hospitals, will get a 10.3% pay rise. Now, that's just above the current rates of, or the average pay, in fact, pay rise is above the current rate of inflation. But of course, junior doctors, they say they've been hit by real terms pay cuts, as I say, for well over a decade now, and they say that's not good enough. Now, the co-chair of the BMA Junior Doctors Committee came out this morning as they embark on their fifth round of strike action. He said an email from Rishi Sunak, the Prime Minister, would be enough, potentially be enough, to bring this current 96-hour walkout to a halt. That's highly unlikely to happen. Steve Barclay, the Health Secretary, he said that his door remains open to discuss with the union about not about pay. It's certainly not about reopening the pay offer. As I say, the government have said that's final, but to discuss other ways of improving conditions for NHS staff. The BMA themselves, they've said, well, our door's open as well for further conversations, but unfortunately, nobody's exactly poking their head out of the room to look at, to walk across and see into the other room. So we are at a bit of a standstill, and potentially 1 month more strikes to go. This is the fifth round of strikes, as I said. And they have a mandate for 6 months of strike action. And if nobody blinks before then, the BMA will have to go back to their members and reballot them and ask them whether or not they want to walk out for potentially 6 more months, which will obviously...
Is there... Sorry, Paul. Is there some politics in this? A previous guest was suggesting that when asked why the doctors were not striking in Scotland, with similar pay offers being thrown around, there wasn't really a response to that, other than what was extrapolated from it is that they quite like the Scottish government and not the one in Westminster. What's the truth of that?
It's difficult to know for sure, but certainly the Scottish government have been, it seems the medics there have said the Scottish government there have been a bit more open. They've made an improved pay offer earlier in the rounds of negotiations, which saw the BMA members in Scotland calling off their strike action. It
wasn't 35% though, was it?
No, exactly. No, far from it. And the BMA leadership in England, they've taken a much harder line. If you compare the BMA stance to, say, the Royal College of Nursing, which, of course, whose members began all this strike action way back in December last year, they gradually sort of ramped up the number of staff, number of nurses who went on strike at hospitals across England. The BMA decided to go on a full 3-day walkout from day one, from the first chance to get the strikes, and 99% of BMA members, junior doctor members, voted for strike action. There's very much a harder line that's been taken from the BMA leadership in England, and consequently the government have now said, well, look, we're not going to reopen negotiations. This is our final offer, the 6% plus the £1,250. That's, I'm afraid, the best deal you're going to get. And government says, look, we need to move on. Of course, the BMA aren't moving on yet, as anybody with a procedure over the next 4 days will find out.
Indeed. Paul, thank you for your time. Very thorough stuff from Paul Gallagher. He's the health correspondent over there at the newspaper.